And you tell me when you're ready. Good morning. Can you guys hear me okay? Okay. I'm Greta Carter. I'm the Executive Director of the Seattle-based Trade Coalition for Cannabis Standards and Ethics. I represent 45 businesses who serve the needs of tens of thousands of Washington patients. I join our elected officials today in a united voice to the federal government regarding the recent attack on our citizens. I'd like you to clear your mind a moment of the picture you think you have of businesses or people who use medical cannabis while I share a story with you. I own medical clinics here in Seattle, where our doctors will consider medical cannabis as an option when treating their patients. My office sits right up in front in one of our clinics. One day, a young man in his early 20s came in, had his tattoos, his nose ring, his crazy mohawk haircut thing going on. And I'm thinking, oh boy, just the kind of image we don't want for our clinic. Someone who is going to use the guise of a patient to get medical-grade cannabis. He had a file with him. He's a quiet young man. He was checked in, and he saw the doctor. After this young man left, I asked the doctor, "Are you sure this person truly qualified for a recommendation?" Her response, "Greta, he's dying from cancer. He probably won't see a year." For this young man, yes, he qualified. I was guilty of exactly what I despise. I judged him based on how he looked. People who serve patients are family members. We are Republicans, we are Democrats, we pay our taxes, we drop our kids off at school, we go to work every day, and many of us struggle to make ends meet. But above all, we are proud citizens of the beautiful state of Washington. The only difference between you and us is that we risk federal conflict. Why do we do it? It's not about the money. Because trust me, most store owners struggle to keep their doors open, and they work very long days themselves to keep their overhead down. It's because we all have had a profound experience like the one I just shared with you. It's a calling that we must fight for social change and be the voices for those that cannot speak out. Today, we're speaking out. We're joining our brothers and sisters from 11 different cities and 9 different states from across this country. Here at the press conference, you will hear from our elected officials. There will be a brief question and answer period following our talk. Later today, the citizens will be speaking out in a peaceful demonstration at the federal courthouse in response to the ongoing attack on medical cannabis. On August 23rd, the Department of Justice took it upon themselves to come into our state and threaten our citizens. They did so by sending out 26 letters. The message was to quit serving cannabis. And to the owners of the property, they were to immediately suspend leasing to a cannabis business, or the federal government would exercise their rights to take their property from them. They would like you to believe that it was because they were all located within the close proximity of school. This is simply untrue. We've been working with elected officials for the past year, some of whom you see sitting at this table. In November 1998, Washington voted approval on medical cannabis. Since then, numerous bills have passed furthering the regulation of medical cannabis. On July 27, 2011, we sat in this exact same room and we saw Mayor McGinn sign the Seattle Medical Marijuana Bill. Clearly, Washingtonians have spoken. We support medical cannabis. In each year's passing, we get better and better at regulating it. So our message today is simple to the Obama administration. As voters, we demand you freeze and review federal intervention. Let states regulate medical cannabis. Use your precious resources elsewhere. I'd like to introduce to you Councilmember Nick Licata.
Thank you, Greta. I am Nick Licata on the Seattle City Council as a prime sponsor for the medical marijuana bill, and I have had the opportunity to talk to many of the medical marijuana providers. My message is pretty simple. The federal actions to close down the medical cannabis providers is making our neighborhoods less safe. Now think about it. The qualified patients that go to these dispensaries by the state of Washington are not criminals. They are people in need of medical assistance. By closing down these facilities, these people in need of medical treatment are then forced to go from a legitimate market to the illegal drug market. This forces them to basically help sustain the drug cartels, perhaps street gangs. It takes revenue that should be going to the public treasury and puts that stream into criminal activity. That is not the way we want to go about it. We want to see consistency between the federal government and the state governments and how we nourish the growth of a legitimate industry in providing medical cannabis to those people who have legitimate needs. I think we have a good, strong beginning here with the state legislation, the way the city's moving forward and other cities. I believe that the federal intervention by threatening to close down medical cannabis providers will halt and certainly deter progress that we have been making in the past. So I'm going to turn it over now to State Representative Roger Goodman, and he will make some comments as well as read a statement from another state legislator.
Thank you, Nick. I'm State Representative Roger Goodman from the state legislature, Vice Chair of the House Judiciary Committee, and Senior Member of the Public Safety Committee, which has jurisdiction over these issues. I work closely with Senator Jeannie Cole Wells from Seattle on the issue of medical cannabis. We've been having conversations over the last few months about the upcoming legislative session and the actions we want to take. We're moving deliberately towards establishing a uniform regulatory system for medical cannabis as an alternative to what Nick Licata referred to as the drug dealer approach, which federal policy over the last 40 years has clearly shown to be a disastrous failure. Senator Jeannie Cole Wells could not be here this morning, but I do have a statement that I'm going to read from her, and then I'll just briefly make a comment myself. Senator Cole Wells says, "I'm sorry I'm unable to participate in today's press conference. I feel very strongly about the need to ensure an adequate, safe, reliable, and secure source of medical cannabis for legally authorized patients who have received a recommendation from a licensed healthcare professional. I also believe that a state-regulated system of licensed producers, processors, and dispensers is the preferable route to providing such access to patients and for public safety and safe communities. In the absence of such a system, as a result of Governor Gregoire's partial veto of Senate Bill 5073 in 2011, our local jurisdictions are struggling with providing safe access and safety of their citizens. What is not needed in our or other medical marijuana states, and there are 17 states in this country that have enacted medical marijuana regulations, is federal intervention against dispensaries that are following state law and local ordinances. What is needed is for the federal government to respect state laws and for the United States Department of Justice to intervene only against those dispensaries and other providers who are not complying with state law. Regarding providers' proximity to schools or other, quote, prohibited zones, I believe the correct approach is to allow for flexibility, to allow local governments to enact ordinances that fit their own jurisdiction's realities. What would be the best practice for Seattle may not be the case for any other city or town. My bill in 2011, Senate Bill 6265, provided that nonprofit patient cooperatives may not be located within 500 feet of schools. However, it would also have permitted local governments to enact ordinances to impose a larger or smaller limit, so they could prohibit a location of nonprofit cooperatives within more or less than 500 feet of schools. Let's remember, we're dealing with our vulnerable citizens who, in using medical cannabis, are able to experience some level of relief from their debilitating pain and suffering as a result of their severe or terminal medical conditions. To me, this can be preferable to their using prescribed narcotic medications, which have harsh and debilitating side effects, depending on what is helpful to them and what is allowable in state law. So that's a statement from Senator Jeannie Cole Wells. I guess our message to the federal government is get off our backs. You know, we're doing it right. The federal policy for the last 40 years has been the most corrosive, disastrous, bipartisan failure in social policy and health policy, and the states are getting it right. Washington State is moving towards a rational regulatory system, and in other states where these regulatory systems are in place, we've already seen reductions in DUI arrests, reductions in youth use of cannabis, reductions in the sale of beer. I'm not sure what the beer companies think of that. But this is good for public safety, what Washington State is doing and what Seattle is doing. Now, the federal government seemed to give us a clear indication a year or so ago in a memo, the U.S. Department of Justice, that they would not intervene in states where dispensaries are unambiguously complying with state law. The dispensaries or access points that the federal government has just served threat letters on are unambiguously complying with state law. And the federal intervention is not justified. Perhaps it's a violation of federal law, but the federal government has very limited resources, and they should be deploying them towards certainly more harmful threats to public safety. And so our clear message to the federal government is just get off our backs and let us do it right. And leave alone these access points that are, in fact, helping people who are suffering. They're not the drug dealer on the corner. They're the much better alternative. And we're going to continue to make progress in this as long as the federal government steps back and lets it happen. Thanks.
Folks, we'll take any.
Since our mics are up there, if you would mind answering questions from the audience.
Okay, we'll open it to any questions that you folks may have.
Could you explain further your contention that the accusation that these access points were within close proximity of schools is not true? You said that was false. Could you detail that, please?
It may be that some of these access points are within 1,000 feet of these so-called prohibited zones, but it's important to understand that these prohibited zones, school zones, let's just call them school zones, are only in state law as a sentencing alternative. It's a special section in the Sentencing Reform Act, so that if a delivery of a controlled substance takes place within that zone and a conviction occurs, then there is a sentencing enhancement, a 2-year sentencing enhancement added to the sentence if that crime, so it has to be a conviction take place, existed in a school zone. These school zones are used nationwide by prosecutors as a way to leverage a plea. So the offender or the defendant will be in negotiations with the prosecutor, and the prosecutor will say, oh, that was in a school zone, you're going to get 2 more years. And so that's a way to leverage a plea so that it doesn't have to go to trial. And there is evidence, there's a Boston University study that showed that in 2% of the cases, the sale of prohibited substances was a sale to children. So in fact, these school zones are used as a prosecutorial tool in the plea bargaining process, but it has nothing to do with medical cannabis. There is nothing in the state law that prohibits access points from being within any feet of a school. It's up to the local ordinances that determine that. So the federal government is not referring to state law. In other words, these access points are complying with state law. Well, as Senator Ginny Cole Wells said, there ought to be flexibility according to what the local needs are. How many feet is a Fred Meyer from a local high school, which is now selling spirits, distilled spirits? I've now heard of, and I was firmly against that privatization of the liquor system, I've now heard quite a number of stories of high schoolers shoplifting distilled spirits from purveyors that are literally next door to the schools. So there's a lot of inconsistency in the law. The question of whether distilled spirits or beer or wine or cannabis or any other intoxicating substance should be sold within a certain number of feet is a policy question. And yet, when it comes to medical cannabis, boy, that's a lot more control than just simply going into a liquor store. So I would be more concerned about liquor being close to schools than medical cannabis, for which you need a medical authorization, and the door is secure, and only certain people can get in.
So I just want to be clear, you're saying that you believe those letters, the 26 letters where the feds are clearly referring to the dispensaries being within a certain location of school zones, that you think that has something to do with another law that has a sentencing guideline?
There may be federal law, and I apologize if I don't know if there's a federal law that prohibit. I mean, these are prohibited substances under federal law for any purpose, so I can't imagine that they would be saying that it would have to be within a certain number of feet of a school. But as to state law, there is no prohibition that access points be a certain number of feet from these prohibited zones. It's only, the only reference to these prohibited zones or school zones is in our sentencing law, so that is a sentencing enhancement after a conviction has taken place.
Aren't dispensaries still technically illegal under the state law?
Could I respond?
Sure.
I'd like to respond to your earlier question. What we are seeing across the country, as a political activist, I'll respond to that, the federal government is making an attack on medical cannabis across the country. It's truly a death by 1,000 cuts. If they're not coming after us with the 1,000-foot rule as part of it, they're coming after us from an IRS attack on the 280E tax reform piece of it. Their intent is to shut down medical cannabis. And what we're here to say is that should be regulated by the states. The people have voted.
Councilmember Licata, could I ask you to weigh in on this? And let me just ask it this way.
Sure.
Do you think that access points should be allowed to dispense medical cannabis within 1,000 feet of the school?
We are currently actually looking at moving towards some sort of zoning regulation, so that's actually open for discussion. But right now, our orientation is to follow the state guidelines. And as we go forward, we'll be evaluating everything. But I think the point that we're concerned about is we do not want to use subterfuge as a means to close down the medical cannabis dispensaries. So whatever we come up with will be very clear and well-defined and not being used as a way to limit dispensaries.
The city doesn't have a rule now on
Not currently. The medical marijuana bill that we passed basically said that if you're in the business of medical cannabis, you must conform to the other rules and regulations that we have within the city for all businesses. So it was a first step in recognizing them as a legitimate business.
What are your own feelings, though? 500 feet, is that enough? 1,000 feet?
You know, I am still in the learning stage. It's very interesting to hear the first time I heard that only 2% of the instances of arrest had to do with children in those areas. I also, not an attorney, I wasn't aware that it was more of apparently a leveraging, sentencing sort of orientation. So, you know, it's an issue, quite honestly, I think that gets at many parents' fears. You know, are we going to have a situation where there's going to be drug dealers in our schools? But, you know, do we also have a situation where we have distilled spirits literally next to schools as well? So there is some consistency I think we want in the application of the law and the application of logic of wanting to have safe schools.
Councilman Cotto, there's about 150 dispensaries in the city right now or so. More seem to open each day. Are you comfortable with the continued boom in dispensaries with them opening in cities around the city?
Well, you know, I actually would prefer that there be many cities in Washington State conforming and following the lead of the Washington State, allowing them to exist. And I think that puts more pressure on Seattle to make sure that they can be run safely and provide good services. And I think by us doing our best job possible, we will allow other cities to recognize that it is, in fact, a legitimate service that should be provided to their residents or citizens.
But it seems like there's a lot of, there's consensus. You said there's considering zoning, that this is a reasonable concern on the part of the public, that there be access points in close proximity to schools. The federal government is giving the state leeway, in effect, to operate in, in contravening federal laws. Is this not a reasonable line for the federal government to draw?
Well, I think the question of what is reasonable should be determined not by one's perception, but should be based on what the facts are.
Are there zoning restrictions for pharmaceuticals and liquor stores in those zones? Is there any restriction
Yeah.
on those businesses?
Not that I know of. We do have restrictions on strip joints, but other than that, and we have zoning on other sorts of manufacturing and industrial and all kinds of things. But as far as type of business, this is not a strong point, but I don't believe that there is on those.
I actually I put this request in to find out whether there's anything in our state liquor laws that restricts the distance of a purveyor of liquor from schools or any prohibited zone. I introduced a bill in the last session of the legislature at the suggestion of Council Member Kathy Lambert, and I agree with her that our courthouse, which is just a block away, should be weapon-free, and courthouses around the state should be free of weapons, and to have weapon-free zones. And I discussed it with her, and we came up with a 500 feet limit. And the legislation that I introduced created 500 feet for all of these zones that we're talking about, weapons and drugs and so forth. If you look at a 1,000-foot radius or 1,000-foot distance, that covers pretty much the entire city of Seattle. There are maybe a few freeway underpasses where you could hang out, and that's not within a zone. But these zones are too broad, and they need to be brought into if they are useful at all, should be brought into a more rational distance. And 500, and I've also surveyed other legislators around the country. In Massachusetts, they're thinking of bringing it down to 100 or 250 feet. None of these bills have passed, but this is the discussion happening, just to bring it back a little bit.
Roger, the dispensaries right now are not clearly authorized by state law. These dispensaries are operating under the interpretation of the collective garden model.
That's right.
What do you intend to introduce some legislation this year to bring clarity in that?
Senator Colwells and I have discussed the possibility of introducing legislation in the next session. It depends on what happens with the initiative, 502 that's on the ballot, whether that passes. It depends on who is elected governor. It depends on who is elected to the state house and the state senate and who takes control of the various committees. But we do have a strong desire to put in place a more uniform regulatory system for medical cannabis to replace what we have now as a patchwork of cities with ordinances. And so, for instance, the cities that I represent, Redmond and Kirkland, among others, are waiting for the state to act before they permit medical cannabis dispensaries. It's not that they don't want them, but they want guidance from the state. So we will move forward if we possibly can.
And that's the same issue that we had the last time before the current rules that the governor vetoed.
Right.
And there's still just as much, if not more, frustration among medical marijuana patients and dispensary owners now. So how is it going to be any different this time around?
Well, the bill that Senator Colwells pushed through in the last session, which did not make it, was a pretty good compromise. People are going to be unhappy with whatever bill it is, but it provided a lot more local control. It didn't put state employees at risk of being arrested by federal authorities, and it was a uniform state law. It sort of collapsed. There was a lot of fireworks going on in the state Senate at the end of the session, completely unrelated to this issue, and that was one of the casualties. But we intend to bring it up again as a starting point. So that we did make progress in this last session over the bill, beyond the bill that the governor had vetoed.
Do all of you support I-502?
I do, because I think we need to send a strong message to the Congress, to the people of the United States, to the world, that cannabis prohibition has been a disastrous failure, and we need to implement rational regulatory approach to protect children, to clean up public spaces, to provide opportunity for people to improve their health. This has been, the federal policy has clearly failed. And
It's better to me that you can respond because the largest critics of I-502 were medical marijuana patients, at least in my experience.
Today, I'm representing the Coalition for Cannabis Standards and Ethics, and our position is that we are not taking a political position on it. I'm more than happy off the record to tell you what I think about it. Thank you.
Representative Goodman, just to follow up though, how does 502 protect children?
Well, as I said, in states that already regulate medical cannabis, Colorado, Rhode Island, in Colorado it's been rigorously evaluated that young people self-report that cannabis is harder to get, almost as hard to get as beer. That the youth, just the survey that came out 2 weeks ago showed that the use of cannabis by young people, by teenagers in Colorado has declined significantly. Some of that might be the inability to get it because it's more carefully regulated. It also might be the sort of forbidden fruit phenomenon where if grandma's using it for cancer, it's not cool anymore. And DUIs are down and beer sales are down. And so that's all good for public safety. Kids right now, there's about 1 million kids in this country who sell marijuana. They're not selling it for profit. They probably get a bunch from somebody and then distribute it to their friends. That's unacceptable. We need to have a regulatory model, and regulating it for medical purposes is the first step. It will absolutely protect our children. Children will find it much harder to get if it's a regulated intoxicant. Like we regulate tobacco, we regulate pharmaceuticals, we regulate other potentially hazardous substances.
The Colorado survey was on.
Okay, folks, I'm sorry. We're going to have to wrap this up. There's other
Medical marijuana,
engagements.
yes.
Okay, thank you so much. I hope we see you at the rally.